Good morning, Jason and Shelley, the cannabis nurses here. We had a research question and we'd like to share some research with you guys on that question. We had a patient out of the state of Indiana named Bethany, and Bethany asked a question about, I'll let you answer. What did Bethany ask us?
She asked us, how does cannabis and diabetes interact? And we're not diabetic educators. We have experience with diabetic patients in the ICU when they get really sick.
Yep.
So we hung insulin to help control their blood sugars and given them glucose.
It's a bit of a complicated question because there are so many different types or different things that can cause somebody to be diabetic. Like,
yeah, you could spend a whole day
you could,
and then some on educating about all the different types of diabetes. But the main question that we're going to answer is, does cannabis interact with your diabetes? Does it help or harm? And the research is pointing that for the most part, it's very beneficial in lowering the blood sugar and regulating it within a normal range.
We were actually kind of surprised. Here's how beneficial it is that we discovered when we were looking at this question for Bethany, that there's actually a drug company making a cannabis pill to help with diabetes. So it looks like the company, would we figure ANANDA Scientific is making, they're working on cannabis medications right now for neuropathy pain, diabetes, opioid replacement therapy, and for cardiovascular disease.
So they found great results with mice. It reversed, they said there's a possibility that it could treat diabetes, it could prevent diabetes, or it could even reverse diabetes. And these are the things that their studies they're hoping will show in the human trials. The rat trials, they had a lot of success, so now they're going to move up to the next stage.
But there is a problem with them doing this because it is unethical for them to put certain cannabis products into the human body, even though we already have these.
It's unethical to introduce even anandamide, which our own body makes. Just like it's unethical to put in any hormone that your body makes without going through proper trials and regulations. Where in the past, when they discovered insulin, they just did it.
Yeah, and it says they went to 6-month trials on his insulin and just gave them, and here we are years and years and years later, and we still don't have this cannabis. We do know that there are lots of receptors in the pancreas. We have these cannabinoid receptors all throughout the human body and all of our organs and tissues. We find more and more every day, and that there are more receptors. So very, very positive finding. I do know that my critical care nurse friend out in Tennessee, Anne, her husband just started on an isolate CBD, and she asked me, is this supposed to lower my husband's blood sugar? Well, guess what? It does. So we also caution with that, if you do take a cannabis product, that you watch and monitor anything that you medicate for pharmaceutical, because it is an entire system regulator. And if you are already taking insulins on a normal scale and you start a cannabis product, you need to monitor, because we are going to see lower numbers than we saw before. So great way to use less insulin, spend less money, and actually with cannabis, we'll get your body to work naturally like you're designed. Thank you, guys.